Welcome back, everybody. Today is National Wear Red Day, an annual effort to raise awareness that heart disease is the #1 killer of women, something many women don't realize. One of the challenges for women is that their symptoms are often different than those experienced by men. So Ashlee Baracy sat down with a women's heart expert to learn what to look for.
We want to dive deeper into women's heart health this month. So joining me right now is menopause certified cardiologist, Dr. Koshi, and give us some insight as to how a heart attack might present itself differently for women in particular.
So women tend to have a bit more vague symptoms, and when I say that, I think most people, men and women, expect your heart attack to be the worst pain of your life, and it typically isn't for men and women. It kind of, if we say 10 out of 10 is the worst pain, most people would say it's between a 4 and a 5 or a 6, 7, so around there. So it's not what you expect. You think that if you are having a heart attack, it would be the worst. So for women, that's pretty vague, and we can push through a 6, 7. And so that's one part of it. The other part is women don't experience their chest pain up in the chest. Women experience it kind of down low, which most women would say that's probably my stomach and not my heart and not my chest, because men experience it up a little higher. Whereas men have one arm pain, women often have both arms aching, shoulders aching. They'll also have pain between their shoulder blades, or sometimes where I say where their bra hooks up. Women will also complain of the symptom of my bra just feels too tight. There's just a tightness, so it isn't a severe pain. It's not a heaviness for women. So the symptoms are a little different. Also, women complain of jaw and neck pain, which can be by itself or associated with those other symptoms, and then shortness of breath and fatigue. These are probably the most common symptoms, which fatigue, we're all fatigued.
Right.
So that one's a hard one, but often right before their heart attack, they feel more fatigue over the few weeks before and more shortness of breath.
Women in particular, I mean, we carry so much of the load at home. I mean, do you encounter that as an issue for women to even go see a doctor, or just kind of the social dynamics for females to be able to catch heart disease early?
Yes, so we're kind of nurtured, or it's our nature to take care of everybody else. And so when that happens, there are women who come to the ER and they're having their symptoms, and we're saying, you're having a heart attack, we need to do this and this. And often women say, okay, but I have to pick up my kids, and do you think I'll get out here in time to get my kids? And and tomorrow I have this appointment to take my mom to. And so there is this dynamic where women are still thinking about everybody else. But I often say, don't forget, just like on an airplane, you put the mask on yourself before you put on somebody else. If you're not there, then none of that's going to get done. So we'd rather help you right now and get that taken care of before we move on.
But given that the symptoms there's such a wide range, and as you mentioned, it might not be the worst pain of your life. I mean, what can we do to kind of get ahead of this? Because so often we're just going to wait for something big to happen to go see a doctor.
So one of the biggest things, and why there's National Wear Red Day and Red Month, is because women don't know. Women don't know that heart disease is their #1 killer. 1 in 3 women will have heart disease. We do a really good job with educating people about that men have heart disease, and a lot of women still feel that it is a man's disease. And so the biggest thing is education. So starting young, we should know our family history, and you should really know your numbers. Knowing your cholesterol, your blood pressure, your blood sugar, your weight, which nobody wants to know, but we do need to know that. Making sure we're not smoking. Those things are important. And then there's pregnancy, perimenopause, menopause. These are big risk factors for women. So mostly educating ourselves that we are just at the same risk or even more because of our hormonal changes and different parts in our life that don't affect men. We should be aware, and the more that we are aware, the more likely we are to seek help. But women also have women's intuition. It is a real thing, a sixth sense. If you know something is not right, something is not right, and you need to figure it out. And so coming to an ER and saying, I know something is not right and I'm having these symptoms, let us figure it out for you. The most common thing I hear in an appointment or in the ER is, so I think that this is what it is, but I'm here. I don't need that. I want to be the one to figure it out for you. Like, you're there, let me do the job.
Yeah, you're the expert.
Yeah.
Even though we're going to do all of our own research and try to figure it out ourselves. Yes. But there are some early indicators for women who might have gone through a pregnancy, or you mentioned, perimenopause. Talk more about that as far as, maybe trying to grab a little bit of an audience that thinks, I'm too young for this to happen to me.
So we consider pregnancy and delivery the biggest stress a stress test of a human's life, right? Which is why women do it. But considering that, if you had any complication during your pregnancy, we know it's a vascular issue. So preeclampsia, eclampsia, hypertension during pregnancy, diabetes during pregnancy. One, we know that you are more likely to have hypertension, diabetes later on in life, but preeclampsia and eclampsia tell us that within 10 years you could have your first heart event. So if you had those kinds of complications, not just seeing your gynecologist, but definitely have a primary and consider seeing a cardiologist once a year just for a risk assessment so we can keep following it and making sure we're doing everything for prevention.
And just women as a whole, what can we do to better our heart health moving forward?
It's hard. We live a busy life, and so, but making sure that you have time for yourself. So stress management is really important for women. Heart attacks occur for women during emotional changes and during stressful times. So stress management, so that includes exercise, moving your body. It's good for your mental health, obviously good for your physical health. We like cardio exercise for your heart. Strength training is fine as well. Making sure you know the things like your cholesterol numbers, your blood pressure numbers, and what your goals are and how you're going to get there. So talk with your clinician about, my blood pressure might be high today. What are we going to do to get it down? Because heart disease is about 90% preventable. The only things we can't change is that you're getting older and your family history. Otherwise, we can change everything else.
All right, well, that's great advice. Thank you so much, and we hope that folks wear red throughout the month to really raise awareness for such an important cause. And thank you for what you do in our community.
Thank you.